The South African government officials have reached a backlash for their approach in the COVID-19 vaccine race. Government is yet to secure supplies for the life-saving shots or made concrete plans despite an expected massive rise in COVID-19 cases. Experts are now criticizing officials for increasingly talking down the prospects for the availability of the vaccine to South Africans. For more on this, we speak to Dr Aslam Dasoo from the Progressive Health Forum. A very good afternoon to you. Thank you very much for joining us. So you suspect the country does not have a coherent and composite vaccine acquisition strategy. Why?
Well, good afternoon. There's no evidence of that, despite having asked for the same for months now. We understood that they had appointed a special vaccine ministerial advisory committee. This was done in September already, and we've heard nothing. None of the advisories have been published. We're getting no information from the system. And then we suddenly hear that, we are going to get vaccine only in the second quarter through the COVAX initiative. And this is extremely worrying because that initiative doesn't leave the amount of vaccine, the type of vaccine, the price of the vaccine in our control. So it's kind of all very vague at the moment. And it's a real concern given the impact of the surge right now.
And you believe that this could be a man-made disaster that could very well be avoided. You speak of a lack of foresight that will visit us in terms of consequences of that man-made disaster.
Sure. And you have to take a view on this. About 8 months ago, several countries started negotiating bilaterally with the various pharmaceutical manufacturers who were putting forward vaccine candidates in late-stage trials. We run 4 of those trials right here in South Africa. And these are all leading candidates, and a couple have already been registered. And South Africa, for some reason, has not done that. Even Kenya is expected to receive vaccine by the end of this month. Egypt, Morocco, Costa Rica, Peru, Uzbekistan, it's all over the world. Countries have done this. We, for some reason, haven't. And it's not explicable, and actually it's not acceptable.
If you were to read between the lines, what do you suspect is behind all of this?
Okay, one doesn't want to speculate, but it's clear that South Africa has dropped the ball on vaccines. South Africans now face the prospect of only receiving vaccines long after other countries have already conducted mass vaccination programs and already starting to reach herd immunity in the next 6 months. We will only get a small batch from COVAX by that time. What is of even greater concern is that we have it from pharmaceutical manufacturers that a couple of them had approached the government but were spurned, saying that we are going to only obtain vaccine from the COVAX facility months ago. And we have no knowledge of where the bilateral negotiations with these companies have begun. We find also the public commentary that has emerged since the media and experts and others have started questioning this. And we find that senior officials prevaricate now and suggest that vaccines are not a silver bullet, or that we can't place much store by them, or that we couldn't buy it on risk before the vaccines were registered. I put to you that is utter rubbish. It's not possible to make those statements if you are aware of what the pandemic is. And we think that that's just spin and perhaps a late exercise to avoid culpability.
What do you make of the school of thought that says, well, on the African continent, we have seen a rising number in COVID-19 cases. However, in terms of the recovery rate, we have done better than many other countries across the world. So perhaps there isn't such a rush for a vaccine. Do you think that's responsible?
Take a walk into any of our facilities today and ask if that is a responsible approach. It is absolutely irresponsible. It's reckless. It's negligent to say something like that, to put out statistics on recoveries which really are meaningless. Right now, we're having such a surge in infection, and we all know this. We are in this second wave, and possibly through a variant that perhaps transmits much more easily. And, you know, our failure to get the only instrument, the only mechanism that can provide population-wide immunity and get us beyond the pandemic is not even on the government's radar. Well, that's not quite true. It is there on the radar, but they're doing nothing about it to any meaningful extent.
Economically, what sort of damage do you foresee this having for South Africa as a whole the longer this is delayed?
Okay, so you're aware that the lockdowns that were occasioned by the pandemic have wrought terrible economic damage, some of it perhaps permanent. In our instance, it has been particularly severe. And, you know, I think that the management of it could have been much better. It is what it is. But at this point, while the economy is recovering, to persist with the strategy that says, look, we'll go into lockdowns or we'll depend entirely on the non-pharmaceutical measures like masks and distancing, which are very important. Let's not take that away. But to depend only on that is specious. We can't do that. We must get vaccines. That's the game changer in a pandemic, nothing else. So if we don't, we will see 2 or 3 more waves like we are experiencing now before we get any doses of vaccine. Every one of these waves has an economic impact. And the big worry is that the health system will eventually break. It's under severe strain now. There isn't sufficient support for the public health system, for sure. And health workers are getting sick. They're getting infected, sick, and they're dying. And they can't be replaced. There will come a point where that lack of ability to replace and lack of resources will mean that the facilities can't cope anymore. The country will not have anywhere to go to for treatment or comfort in that instance. If we at least got vaccines for our health workers, they could then be protected and continue stabilizing the health system as a measure in the interim until we get vaccines for the rest of the population. I think we must make peace with this. I think the government has dropped the ball. They don't have a plan for vaccines that will get us sufficient doses in good time. That's done. We now have to move from that position. So we need to make a plan rapidly to vaccinate our health workers first. And then, at the same time, do our damnedest, beg pharmaceutical companies for vaccine. We'll have to be right at the back of the queue now, but we have to do something. And for us to get spin and statements that don't get us anywhere is not just irresponsible, it's negligent. And we have called on the President to act in terms of his constitutional authority to remove these people from these positions forthwith and to replace them with people who know what to do. And so that, because this is an existential crisis for the country.
In 30 seconds for us, Dr. Dasoo, the Health Department at 6:30 will be holding a press briefing in terms of the vaccine rollout strategy. Your expectations, if any?
Very low, but one can expect that if they have been stung into some action, they may come out with some plans along the lines I've suggested. And I'll be very grateful if that is the case, not because they have done well for us, but because we might get vaccines for our people. In any event, I think we should wait for that and hear what they have to say. I'm not very hopeful, though.